Dr. Jill Vecchio. Thank you, Michael.
I feel older and older every time I have to go up and down steps. Okay, great. And this is for my hot flashes, so you know, it's overwhelming, isn't it? This is the real cause of global warming. Thanks to everybody for being here. I'm just going to talk about one little aspect, but I think it's an aspect of healthcare that I haven't emphasized so much in the past, and I don't think anybody else really has either. So recently I had breast cancer. So I had breast cancer, hence the hot flashes coming back. So I had breast cancer surgery. Piles. How many women have had surgery? How many people have had surgery recently and gone through these piles of, I have Cigna, of insurance company? This is not a bill. This is just letting you know what we've done for you. Okay, great. So, and every time there's a charge, you get a statement. Can't they just wait and send it to you like, here's all the stuff that was involved with your surgery? Anyway, I'm looking at these, and I kind of knew this to be the case anyway, but it was gratifying or frustrating to see that this really was the case. So, on the bill, on the little statement, I should say, this is what was charged by your provider for this service. And let's say, for example, one of them was, and this is true, one of them was like $4,000 for a surgery, for a surgeon's fee. This is what the charge was. This is what was paid, $400. Okay, so the charge, $4,000, what was paid to the provider, $400, what you owe, $0. You saved $3,600. Wow, this insurance is great. A 90% savings? Walmart couldn't do this well, right? So, and when you look at this, you understand, you say, why do they do that? Why is there this charge? Does anybody ever pay that charge? Sure they do. Anybody who wants to pay cash. That's the first thing they'll tell you is, oh, well, if I want to pay cash, Mr. Surgeon, how much do I have to pay? Oh, well, it's $4,000. You kind of go, I don't think so. Oh, my God, nobody could ever afford this. We need to have insurance. My God, we can't pay our insurance premiums. The government now has to take over, so we don't have to pay that $4,000. Are you following me here? The reason, those charges are all fictitious. They're fantasy numbers. They don't exist. Nobody pays them. So why are they there? They're there, in my opinion, to scare us, to control us, and to control how we feel about health care. And the other reason they're there really is so hospitals can say, we gave this much in free care, in unreimbursed care. So if somebody doesn't, like an indigent person, no insurance, comes into the emergency room, rings up all of these charges, right, and they don't pay their bill, the hospital could say, we gave this much money, this much worth of care, and therefore this is going to pad our pockets for when we want reimbursement from the federal government, when we want to do our books and claim, we have a certain amount of, any company has a write-off amounts for unreimbursed or outstanding receivables, right? Bad debt. So we get to write off the charge amount, not what we would have gotten reimbursed. Is everybody following me here? Yeah. It's a scam. It's all a scam. Now, how many times do you hear, I went to the hospital, or my husband had a heart attack, and those bills were $150,000. How in the world? This healthcare system is out of control. Well, if they looked at what was actually paid, the statements, they would see that the hospital probably got paid $15,000, not $150,000. So what is bantered about is, as healthcare cost, is healthcare charges, not what it costs. So when you really think about that, whatever you see as a hospital or any kind of a medical charge, go at 10% of that. 10% of that. If we could start paying, and Linda Gorman is going to talk about this stuff too. People talk about, well, let's go to a cash system, and everybody goes, oh, we could never pay that. Who could ever pay that? Oh, only the rich people want this. Baloney. If we went to a cash system, you'd be talking about that 10% number, not the 90% number. If you weren't paying, and I think about it, I've had 2 cancers, and then, my employer or myself have been paying into insurance for, how many, my whole life. Even though I've had 2 cancers with surgeries and everything else, the insurance company has still probably made about $75,000 on me. What if you had that money back? What if you didn't have to pay, like right now I'm paying $800 a month in health insurance with a high deductible policy, right? Cobra. So what if I had that money back in my pocket and I could put that into my own account over here? That money would add up pretty quick. And I could go in and say, I want to pay cash for this. What's it really going to be? Now, the other problem is, and this is your call to action today, is when how many people have gone to the doctor and say, how much is this if I pay cash? How many people have done that? How many people have had the doctor or provider look at you and go, huh? What are you talking about? Oh, we don't really do that. We're going to submit it to your insurance, and we'll see what they're going to pay, and we'll kind of let you know. Who does that? Like if I walk in and want tires, a new set of tires on my car, they don't say, hey, you know what, let's wait until we get the tires in the car, and we're going to balance them and everything else, and we'll let you know how much it's going to be. Who does this? But that's what we've allowed. We have allowed this black hole to exist and for people to take care of us because and now we're being told the system is so complex that there's no way on earth that any of us could manage it. And it's just not true. I'm sorry, if a Medicaid patient can manage the Medicaid application, let alone walking through that system, these aren't stupid people. They make it very difficult because they want it to be scary. They want to keep control of it because they are making a ton of money. Who has the nicest buildings in town? Insurance companies. So there's a reason why they're interested in this market. And the government has, in my opinion, when they're talking about single-payer systems and everything else, it's much to their benefit for us to feel confused and helpless and hopeless. So, my call to action for everybody here is very simple. Anytime you have anything done, if you fill a prescription, if you go to your doctor, you go to your dentist, say, how much would this be if I paid in cash? Oh, you have insurance. I don't care. How much would this be if I paid in cash? Just out of curiosity, I want you to tell me before I walk out the door. Okay? If everybody starts to ask that, just ask it. Even if you're not going to pay cash, I don't care if you're going to pay cash. It just shouldn't matter, should it? It shouldn't matter how you're going to pay for it. But, as long as you are going to pay for it. But if every one of us starts asking, then these providers are going to finally go, gosh, everybody's asking for a cash. Maybe we really should come up with a cash number for people who want to pay. Because unless we ask for it, unless we demand it, unless it comes from the bottom up, it's not going to happen for us. We know how the top down doesn't happen, right? It doesn't work. We're not going to get anything from Congress, no matter who's in office. We're not going to get it from Congress. It's going to be really hard from the state legislature with the makeup of Colorado. If anything is going to change in healthcare so that we get pricing and real true pricing in healthcare rather than this ridiculous charge scare tactic, then we're going to have to do it ourselves. It has to come from the customer. These people are in business too. If enough customers, and how many people now, so many more people have these health savings accounts, so they are having to pay cash for some things. If all of us start asking for it now, we're going to start getting it. We're going to start changing things from the ground up, and I think honestly that's the only way it's really going to happen for the average person as quickly as possible. Okay? That's my call to action. That's just what I'm going to talk about now. A couple of other things. There's one thing about the Initiative 20, because this has really kind of been around for a long time. Irene Aguilar, the senator, has been a part of a website, Universal Care for Colorado, I think it's called, doesn't it? I think it's universalcarecolorado.com or something. I think I have it written down. But they've had this website for years. Through this website, this organization that wanted to promote single-payer healthcare in Colorado, they paid $17,000 to a Massachusetts economist, which these days is kind of an oxymoron, but a Massachusetts economist to come up with costs for the 3 options of healthcare. The 3, because there are only 3 options in healthcare, we all know that. The only 3 options in healthcare are what it was before Obamacare, and the single-payer system. Right? Those are obviously the only 3 options that there should be in healthcare. So they paid this Massachusetts economist to come up with this very impressive paper saying which systems are better. Remarkably, Obamacare was the worst. Like we don't know that. The next best, or the next worst, was what it was before Obamacare, which was a screwed up system. A totally screwed up system. Screwed up by who? The government. Government interference. Why do we expect anything different? And yet, more government interference is their answer. And that's what was supposed to be, the most efficient and effective. So they never even considered any kind of a free market, patient-driven system. So when they talk about Initiative 20, that's what they're basing all of their conclusions on. That's what they're basing all of their rhetoric on, was this study that they paid for, knowing obviously what conclusion they wanted. If you want to study, and you want to fund your study, then you fund a study that comes to the conclusion that you want them to come to.
That's right.
So anyway, they weren't stupid. So, but that's the study that was based on this Initiative 20, and hopefully we're going to ramp up Initiative 20 talks more and more. But thank you very much, folks.